Hi, everybody. It's Howard Gearhauser here alongside my dad, Dr. G. As you can tell, we both have our blue blockers on. The reason we're wearing these is because this is one of the main things you can do to prevent getting the coronavirus and to really bolster your immune system. So this is one suggestion. We want to give you some other things that you can do in order to protect yourself from the coronavirus, but also if you're starting to feel symptoms like the dry cough, or the fever, or the runny nose, or the shortness of breath. If you think you might have it and you haven't been tested, there are some things you can do to combat the virus. So we want to share that with you, and hopefully you can walk away with some tips, not only for yourself, but for your loved ones too. So Dad, can you explain a little bit more about the coronavirus? I know that obviously we've been hearing about this nonstop, but there's some things that even I didn't know about it that you explained to me that might be beneficial for our audience.
Okay, well, the first thing is kind of defining terms here. So the coronavirus, is a coronavirus, but there's many coronaviruses. So this specific virus that is creating the havoc in our world at the present time is the SARS-CoV-2. So that's the name of the virus. And it gets confusing because everyone talks about COVID-19. So COVID-19 is the pneumonia that the SARS-CoV-2 virus creates in humans. So there's the name of the virus, SARS-CoV-2, then there's the name of the disease, and that's the COVID-19. Not that that really matters. We're all talking about the same thing, whether we say corona or COVID-19 or SARS-CoV-2, it's all the same thing. We're all kind of, our whole world's been turned upside down by this virus. And, you hear all kinds of stuff on the internet, on the news programs, and you hear about the conspiracy theories. Well, one of the conspiracy theories that in my mind has been put to rest, but, nothing is known for certain in our world, and I would say anything could happen. But today was published a report, and this was published by a Christian, what was his name? Anderson. It was at the Scripps, he or she, I'm not sure if it's a male or female, is at the Scripps Institute in San Diego area. And they have been studying this virus, and what they found is it's very highly unlikely that this was created in a laboratory. So this probably is not a weapon. They think there's two major hypotheses for how this virus came about. One would be evolution within the animals that this virus is commonly in, and that's bats and cats and ferrets and some other animals, that there was a mutation, and that mutation caused this virulence and also caused it to be easily spread. So the mutation where it's able to bind on to its target strongly. So that's an important thing for these viruses, is they need to bind on. So they're constantly mutating, and that's evolution of viruses. They're mutating and trying to find a better way to reproduce. So this is a virus that found a better way, either through natural selection in the animals, or the other possibility is that a human got it, got the virus, the unvirulent or the less virulent virus, got the SARS-CoV virus, and that it mutated in the human to become more virulent and then begin to spread. But what they can do when they're studying these is kind of reverse engineer. And I don't know exactly how they do it. I'm sure it's mathematically and biochemically, but they can reverse engineer it to see approximately when it started by its genetic progression. And they estimated that it started in November or December. So this is a new virus, and that's why no one has immunity to it. it probably started in animals, and it either became virulent in animals and then was transmitted to humans, or was transmitted to humans and then became mutated and became more virulent in humans. So, you hear a lot about the conspiracy theories that, this is a bioweapon, and that creates more fear, more confusion. But these top level scientists say no, and let's hope they're right, because it would be better if this is just nature, using nature's rules, and we have to live with nature because we're part of nature. And so nature, works in certain ways, which isn't always good. And so in this case, we just want to try to stay positive. We want to take action, positive action that will reduce our risk, and we'll go through some of those things today.
Exactly. And for a lot of you that are at home, maybe work's been canceled or whatnot, kids are at home. This is a really good opportunity to focus on your health, focus on your relationships, reconnecting with nature. You can't be afraid to go outside. We've talked about the social distancing part of it. You shouldn't be in groups of people, but go outside, go take the dog for a walk, go reconnect with nature, go focus on your health, start implementing a lot of the strategies we've been teaching. That'll take your mind off of the coronavirus and the panic. It'll get you reconnected with nature. That'll get you feeling a lot better, but will also bolster your immune system. So now we want to talk about, maybe you're starting to freak out a little bit because you're getting a sore throat, you're getting a dry cough, you're getting the shortness of breath, and your mind's starting to say, do I have this freaking virus? What do I do? So there's some practical things that you can do if you start to notice some of these symptoms, whether or not it's the coronavirus or something else. Can you dive a little bit deeper into these recommendations?
Okay, well, it is kind of at the end, but we're still in the flu cold season. So a lot of people, thousands of people every day are getting a cold. Thousands of people every day are getting the flu. And the flu and the cold, the cold, doesn't kill you ever, or very rarely. The flu kills you, but at a much lower percentage than this COVID-19 disease would kill you, because the COVID-19 disease is a pneumonia. So our lungs give us oxygen. So oxygen is the terminal electron acceptor for the way our body produces energy in our mitochondria. So without oxygen, we have about 3 minutes to live. And so if your lung tissue gets damaged by the virus, so what viruses do is they kind of inject their RNA into our DNA to hijack it, to make another virus. So our own cells are hijacked. And what that does is the cell then doesn't do the functions it's designed to do. And if that's a lung cell, then you're not going to absorb oxygen because that cell is damaged or killed by the virus. So that is the problem. So the main symptoms are the sore throat or dry cough or fever. So if you have those, if you have a runny nose, and you feel low energy, I wouldn't worry that you have the COVID-19 disease. I mean, you could have it because some people have minor symptoms. In fact, some people may even have no symptoms. So a cold's much more likely because the common cold is very common. So that's more likely. So if you just have a runny nose, sore throat without the fever, and you don't have the cough, I wouldn't worry as much. If you have the fever and the cough, and if you're short of breath, then I would definitely go get checked out, even though there's not necessarily any treatments that help you in that stage. Now, there are treatments that can help you a lot once you have COVID-19, once you have the pneumonia, and once your oxygen goes low, they can put you on a ventilator or they can give you supplemental oxygen. Another thing they can do, which I don't think they're doing, and this is if you're in dire straits, like one of those people in the ICU with this, one of the things that could be used is called the Merrick protocol. And we've talked about that before, but the Merrick protocol is giving intravenous vitamin C, thiamine, and glucocorticoids. So that can be life-saving. Look up Merrick protocol, write it down. Then if you're in that situation where you or a loved one has this and they're in the ICU, it's an inexpensive way to possibly, no one knows because it's too early. No one's tried this therapy yet. But because this therapy is so effective for sepsis, and these people die often with a sepsis-like illness, it makes sense to try it, and it's inexpensive and probably not a great downside in that most people tolerate vitamin C and thiamine, which are just vitamins, tolerate them very well. And glucocorticoids are something that are being given now if you have COVID-19 intravenously. So they'll give you that. But the life-saving thing is when you can't get oxygen on your own, to be put on a ventilator or to use the extracorporeal oxygenation. Those machines are in limited supply, and so are respirators. If the projected slope of the curve of new infections continues and the percentage of severe cases continues as it is, we're going to use up all of those respirators within a few weeks. And this is what happened in Italy. This is happening as we speak in France. I was just reading about a physician that's on the front lines in France, and they're seeing just what happened in Italy, right now, today. They're seeing that as their cases start to go up. They're starting to think about, okay, how are we going to decide who lives and who dies? And usually that's by age. If you're old like me, sorry, you already lived your life. I'm 66. I wouldn't make the cut in France or Italy to be put on a respirator. I'd be, they would, do their thing and send in the priest. Okay, so what you might do if you're starting to feel it is just start taking vitamin C, ascorbic acid. So vitamin C has antiviral properties. It has many other properties that might be helpful in a sepsis situation. It's very unlikely that it could be harmful. Thiamine is really important in low oxygen states, and it gets depleted very quickly. So if you're taking supplemental thiamine, best would be IV, but most of us do not have access to that because, it's just not available. Doctors don't give vitamins IV. People don't keep IV vitamins in their house, although it might have been a good idea. Because if you are taking vitamin C and taking thiamine and have been doing the other stuff that we tell you, one is guarding your circadian rhythm. So how do you do that? Well, you get out in the sun during the day. Sun also makes vitamin D. Some of you might still be in vitamin D winter, where the UVB light still isn't penetrating because of the time of the season. But here in Arizona, we get UVB year round, and I've been in it a lot. Not saying I'm going to survive COVID-19, but I'm hoping I will, because, most of us are eventually going to get this probably if things keep happening the way they are. So you want to build your vitamin D. You may not be able to do that now. Like, let's say you live at a high latitude and you're still in vitamin D winter. You could see if someone has a vitamin D lamp, a UVB lamp. Spurdy is a company that makes those. And that might be a good idea to use that light to build your vitamin D, which builds your immunity, which will help your body fight this off. Now, the other thing with circadian rhythm is blocking artificial light at night. Because if I look at my screen here when it's night, if I look at my screen without eye protection, then my brain switches its circadian rhythm to, oh, it's morning. And you can think of the chaos that causes in your body where, okay, I saw the sunrise this morning, so it got switched on then that it's morning. And then at 7:30 at night, it gets switched on again. Oh, it's morning again. Screws up your system. They show that when people get exposed to a virus, the time of day, and this mainly has been studied in animals, but the time of day has a big impact on whether you get sick from your exposure to a virus or not. And guess what? If you get exposed during, like you're a daytime animal, humans are diurnal creatures, daytime animals. If you get exposed in the afternoon, you're way more likely to fend it off than if you get exposed late at night. So there, the parties, the basketball games, all these things where we go out late at night into bright lights are risky, so that's something that, yeah, they cut all that out for good reason. But if you're sitting at home staring at your television or staring at your computer all night long without eye protection, what is the eye protection? It's blue-green blocking glasses. So you want to block the wavelengths from 550 nanometers below that, all the visible light below that. So that's all the blue and most of the green. These glasses I have on, I bought from a company called Light for Fitness. There's a lot of companies that make blue blockers. RA Optics is another one. I like these because they're kind of wraparound and the light, it doesn't come in the side as much. But these, they've done the studies. These protect your melatonin. Melatonin is so critical for an optimal functioning immune system. You have to protect it if you want to lower your risk. So one of the biggest things besides setting your circadian rhythm to get your hormones in the proper sequence by being outside during the day, and then at night, either turn off the lights. You can use candles because candles don't have green or blue light. So candles, a kerosene light, those are okay. Wearing blue blockers is good. I also cover up when I'm indoors in artificial light. I wear long sleeves, long pants, so that I cover my skin because we have photoreceptors in our skin as well. And one of those is melanopsin, and melanopsin is kind of one of the key photoreceptors. It's in our eye, so you protect it there, but it's also in our skin and it's also in our fat. So all the artificial light exposure at night could be problematic. Another thing is stay hydrated, stay super hydrated, because viruses have a lot more potential to penetrate your tissues when they're dried out. We have a better immune response when we have adequate hydration. So hydrate. Now, I haven't heard that this is true, but because coronavirus is a flu virus or is a cold virus, zinc lozenges might be a good idea. Have some on hand if you start getting a sore throat, taking those, or maybe prophylactically, if you have to go to the store, you have to go somewhere where there's a lot of other people, taking a zinc lozenge, even though I haven't seen anything whether any experts think that is, a reasonable thing to do. I haven't heard that. I just thought of it just now. The other is gargling with either a very dilute hydrogen peroxide or with salt water would be a good idea to several times a day gargle, again, especially if you go in a situation where you might be getting exposed. Gargling is good. So the sun is important for circadian rhythm. It's important because UV light kills viruses and it kills bacteria. so you can sterilize whatever you have in your house that may have been exposed. Even if it's your hands, get them out in the sun at midday, will disinfect the virus. So it's a simple way to disinfect things is use the UV light. Now you can buy UV lights. You know, that's what reptile lights are. You can go to the pet store and buy a UV light. The UV light has benefits in that it can, if it has UVB, it can create vitamin D. UV light also is important for, as I mentioned, disinfecting things. And then UV light also has physiologic functions that I'm not going to go into now, but it's really important to be 100% healthy. You want to get a pretty good dose of UV light every day. And the older you are, for all of this stuff, the older you are, the more you have to do it. If you're old like me, you got to be out in the sun way more than a teenager does, because a teenager's skin works like that to create vitamin D. A teenager's immune system responds like that to vitamin D. An old person, an old fart, you know, their skin doesn't make vitamin D like that. Their immune system doesn't respond like that. So they are at much greater risk. So for them, it's even more important.
So there was something that you sent me about anti-inflammatories and how you should be careful with those. Am I wording that properly?
Yes, well, you sent me that, but I didn't look at it in detail. But what it was a statement by someone that's saying if you gave anti-inflammatories, their condition worsened. And I think that was someone treating COVID-19 patients. And to me, that makes sense. You know, I never recommend bringing a fever down with anti-inflammatories or with Tylenol, okay? Because part of our immune response is inflammation. So by taking an anti-inflammatory, you blunt your immune response, which isn't always bad. So that's why I'm just speculating here. Please don't mark my words, or don't, you know, rest everything on this. But I'm not a fan of taking non-steroidal anti-inflammatories. We do give, though, steroidal anti-inflammatories. As I told you about the Merck protocol, we do give them, but the non-steroidals act in a totally different way than the steroidal anti-inflammatories. So I'd avoid the steroidals, and then Tylenol or acetaminophen, which is given for fever all the time. It's also given for pain, like if you have body aches, it feels good to get rid of those body aches. And it feels good sometimes to get rid of your fever. But a fever might be good. We find that the virus is sensitive to high temperatures, and the innate intelligence of the body raises that temperature up because it knows that's what it takes to save you from eons of evolution. The body's figured this out. Nature has figured this out. And then we want to, you know, blunt the effect by taking Tylenol. So I would not take Tylenol because it depletes glutathione. And Tylenol is the biggest reason that people in this country need a liver transplant, is because acetaminophen is toxic to the liver because it lowers glutathione, our master antioxidant. You know, protects us from all the chemicals that have an unpaired electron. Glutathione is our protection from that. So if you're taking acetaminophen, which drops your glutathione levels, makes no sense whatsoever, even though I've made that mistake myself. I've taken ibuprofen, I've taken acetaminophen, because that's what the doctors tell you to do. But this doctor is telling you, do your own research, take responsibility for yourself. Once you look at the research, make your own decision about what you want to do. And, you know, Tylenol or the non-steroidal anti-inflammatories, they don't have any antiviral properties that we know of. And the preliminary reports are saying they make the outcomes worse. So I would say, to err on the side of safety, just don't bother with those. What should you do instead? Stick your head in a bucket of ice water and keep it there for 10 minutes, and you won't have to worry about anything ever again.
Yeah, and it's kind of getting back to just the idea of following nature versus trying to tamper with everything that nature does. There might be a good reason, like you mentioned, that we get the fever when we have a virus to help eliminate it. And if we eliminate the fever, then maybe the virus, can live within us longer. So following nature, following what your body innately does might be a smart play here. And we gave you some other recommendations too. Should you come down with COVID-19 or start feeling like the symptoms of it, here's some good recommendations. But really getting back to nature, don't just lock yourself in your house sulking. Get out in nature, use this time to take control of your health, take control of your life, and figure out what's really important to you. Is there anything else you want to add before we sign off?
I would say, the advice I give if you're having symptoms, is just speculation on my part. This virus coming about just a few months ago, no studies have been done. Vitamin C is something that is safe at pretty high doses. If you take too high a dose of vitamin C, you get diarrhea. So your body kind of has a natural mechanism for realizing you've overdone the vitamin C. And if you take a recommended supplemental amount of thiamine, I think that's safe, but you still should run it by your doctor. Same with the zinc lozenges, those kind of things. I'd run them by your doctor and ask your doctor if you should take ibuprofen or Tylenol. I'm not practicing medicine here. I'm just telling you what I tell my family and what I'm doing myself. Absolutely not telling you what to do, but just giving you some ideas that I think are safe and I think are no-brainers. But, it's something that I might be completely wrong. And vitamin C might kill you in 5 seconds after you take the first dose.
Yeah, we'll pray that that doesn't happen, but definitely do your own homework. Everyone's different. Everyone's going to respond differently. This is just a fresh perspective from maybe some of the other things you've been hearing or researching online. So we wish you guys the best of health. Stay strong, hang in there. This will pass, and you'll probably come out a better, stronger person because of it. Thanks for watching. I'll see you guys on the next video. Thanks, Dad.
Thanks.